Namaste, viewers, and welcome to this episode of Be Consciously Healthy with Dr. Maria. Dr. Maria, thank you so much for making the time to join us. As you know, viewers, we are all on a journey to learn about the different processes of healing, to have wonderful golden years, to live long, healthy lives, to increase our health span, not just our lifespan. And Dr. Maria here is willing to help us on this journey. And we've just learned that she's got this wonderful new certification in integrative medicine. She's a fellow of the Society of Integrative Medicine of the United States. It's a very prestigious fellowship and, the most well regarded. It's through a University of Arizona program. We just talked about it in the last episode. So, Dr. Maria, my question really is that, it's been a lifelong learning journey for you. And I want us to sort of go down the memory lane, if you will, just, briefly, from your MD, from your time as a nurse practitioner yourself, you tended to your mother, and how your own outlook has changed gradually. And I'm saying this because I think all of us, from the other side who are trying to, be more conscious, we also need to have a little bit of a paradigm shift in the way we approach health, our own bodies, and the entire business, if I may say so, of medicine itself. So, tell us a little bit about your journey, your lifelong learning journey, if I may call it that.
Thank you, Professor Paranjape. I am honored to be here, and my lifelong journey is not easy to really say in a matter of minutes, but I will try to consolidate. After I finished high school, went to undergraduate school in New York. I got my bachelor's of science with a specialization in respiratory therapy. So I became a respiratory therapist, and which really opened my eyes to the world of the lungs. The lungs are, a beautiful entity in and of themselves, and it really had me totally express my gratitude at the time and to this day for what we have, what we call our breath. So respiratory therapy was a stepping stone into medical training, and I went from a respiratory therapist, full-time registered therapist, who got to know every bit of how to take care of the body. From there, into the arms of New York Medical College medical training, which took me then to question, is this it? So I was already looking into the other worlds of disease treatment and other means and ways. So while I was in medical training, I was already looking at alternative methods, because in your medical training curriculum, as it was back in the day, I go back a long way, there was really no discussion or training on real health related subjects and topics and so on. It was all about, finding out disease and what disease can be treated, and the different treatments, which involved either some surgical, pharmaceutical, or some other means that was not natural to the human body. And other things that, therapies, like I was a respiratory therapist. I knew about the ancillary treatments, the physical therapies, speech therapies, and other such types. But, there was something else in medicine that was just not getting to the heart of the matter as far as I was concerned. So I was already looking into alternatives. And and I was already seeking out that information as a medical student. So I got myself involved, I had my hands in, got myself involved in a lot of pathways, finding out more information. So my interest in all of this, it actually came as a result of my mother's illness, which was a terrible uh, case of multiple sclerosis.
Oh, very
And I saw
difficult.
that what was happening. I was going through training, and I saw that what was happening in the conventional training that I had, and the conventional treatments that she was having, it was not going to turn her disease around. And so that really was the motivator for me to look at other things, because I said, you know what, things aren't working for her. The type of treatment she was getting was really not touching her disease, which eventually, unfortunately, took her life at an early age. I mean, she was 54, but she was not really helped, unfortunately, by convention. And I really had no tips or references by the conventional doctors that I had to deal with as a young woman about natural treatment, which I find that I'm using now that is helping people like my mother and others like her, and who have similar conditions, neurologic and otherwise. So she was really my inspiration. She was my inspiration to do all of this, and then explore after medical degree obtained, and that was an achievement. It was wonderful, but I knew I was not stopping there, and I just kept going. And then I went on to study naturopathic medicine, even as I started practicing medicine, so-called practicing medicine. And to me, the practicing is, it's kind of a strange word, to practice medicine. I think we need to just, be teachers and instruments to help people get to a healing. They need healing. Curing, on the other hand, is where you can take away the symptoms, you can kind of put things to rest, but you don't necessarily heal the person. So conventional medicine really doesn't get to the healing as far as I'm concerned. It doesn't do it enough. So I felt that I needed to get really the whole picture. Hence the holistic approach. That's what I needed to know about. And I was going down avenues and looking and seeking truths and what else was out there. And through naturopathic diploma, studying about the natural healing methods from Native American healers and others coming around from around the world, that started me then into down another path of lifestyle medicine, which I did a course in that and got my diploma in lifestyle medicine, and then I went on into integrative course and so on. So I don't stop, and I just keep opening up doors to help me understand more about health, which is not easy. It's not easy to know all of this. It's like we have a divine creation called the human body amongst the entire living ecosystem. This is very special, and it requires such deep reflection and understanding. And the conventional training is just part of it. It's not the whole picture.
Yes, exactly. I mean, it's very inspiring to hear your story in the sense that it starts with a very personal and observed and, uh, you know, uh, you might say, challenge in which you participated, your own mother. And then losing her at an early age shows you the limits of a certain kind of treatment, which has become established, institutionalized, and almost all other approaches get delegitimized. And of course, now things have changed, thankfully, quite a bit. But I
Yes.
was so struck by how it started with breath, because in our earlier episodes, you, in fact, told us about breath work, how important it is. Pranayam, we mentioned. So I see that continuity, the continuity of spirit, so to speak, because the Latin word for breath is spirit. So it's really profound if one goes into it. As you said, the human body itself is a miracle, and if you treat it as if it were a machine or a box or an object, which has a cause and effect predictability, then you're going to lose out on its potentialities, its tremendous capacity, for self restoration, for healing itself, homeostasis we call it, its tremendous regenerative capacities. And we lose our own power and energy over our bodies. So it's very profound. And I was also very struck by what you said about how the standard approach is all focused on disease and not on health.
It
And
is.
the switch that all of us need to make at whatever stage in our lives we are, is to focus on health, well being, and not just on disease, you see? So I think these 2 points were really, at least to me, very important. So now, a kind of follow up question. So let's say a patient comes to you and, they have a chronic ailment, let's say, not an acute, disease or an emergency which requires immediate hospitalization. So, what is your approach? Will you start with lifestyle, or do you? I mean, my real question is: you've got all these different training, and diplomas, trainings and diplomas under your belt, as it were. How do you integrate these? You have your conventional certification. You can whip out your pad and prescribe practically any medication out of this pharmacopoeia of literally thousands and thousands and thousands of drugs. And then you have all of these other things also at your command.
Yeah, it's just kind of mind blowing. What my approach generally is one that comes from my heart. Uh, each of us who learns all of these different techniques, brings on all of these different tools, uh, enlightened, so to speak, on what it all really means, and it really is one big collective picture, and you just, as an individual, you have to pick out and choose what you feel is best for the person in front of you. So my approaches can be one where I first relax the person, have them, come into my sort of living room that I have in my center, and have them just relax. They don't have to, be tense. And I generally don't put on my white coat. I rather not use it because it is very anxiety provoking. The white coat syndrome is a real thing, and it can actually block a lot of the thought processes that people should allow to flow when they're in with someone who is looking to help them to healing. So I try to take away the blocks. So they come in, it's a nice atmosphere. They have the sun usually out, the glass, everything is open. They have sort of sofas to choose from. They can choose their seating, and I have them relax. I may say something that makes them smile, something funny. I have a few little amusing sayings in my room that they laugh at. And once you start that relaxation process, that's like, a good percentage of getting to goal. The goal is to help the person heal. Can we heal a person in one shot, one visit? We might be able to. I've seen some very nice things happen. So relaxing the person, having them breathe with me. So I take in those things that have been part of me and part of what I've learned for all these years, and I just bring them right in. So again, you fully integrate things that are taught and experienced, and they just come. So I'm not there just saying, hello, Miss So-and-so. I need to know what you're coming here for, and let's start with your, what you've been diagnosed with before, and tell me about the drugs you're taking. What about your family history? Anybody in the family sick? I don't go there, not immediately, but I do use history taking in my way, so that can sort of ease them into finding out. I'm finding out of where things may be coming from. A lot of their historical information is going to guide me and clue me into where we're going with their problem. For instance, an adverse childhood experience. They may have been traumatized as a child, which is all too common, which could be leading me down a path where I have to recognize that scar that has led to a certain symptom or a manifestation of a disease, a cancer, for instance, or some chronic headache, or some serious pelvic pain. There's a host of things that I see here, and they all mean something. And the place in the body is reflecting a pathway that is connected to feelings, emotions. So I have to put all that together. So I start to bring all of these elements, experiences, interactions, relationships, food relationships, type of lifestyle activities that they get involved with, their lifestyle. What do you do? And tell me about what you do. How do you spend most of your time? Do you sleep well? Do you have a problem? Are you interrupted at night? Are you using a cell phone just before bed and leaving it next to your head? Did you have a fight before you went to sleep last night that is angering you today? Did you have a problem with a partner or someone else? Do you have a child that is troubling you in one way or another? Or what is your relationship with your child or children? So we get into different questions, and I tell them right off the bat. I said, I might jump around a little bit. We might be doing a dance between your diet and your partner and your surroundings and your workplace. And all of them are part of the process. I cannot separate one from another. I cannot. So this is where I go, and I usually find that to be that integrative approach, which involves the lifestyle. The lifestyle is just a word, and naturopathic is a word, but it's all encompassing. Integrative, it's kind of all encompassing. So I say integrative is really the word that I use to bring all this together. And so we go down a path, we look at all these elements. We can sometimes have to stop because a person becomes emotional, and we stop, and then we start doing a little exercise right there. I can use different techniques that I know. And then we can then have an action plan and make it so that they don't feel so uncomfortable. I can give them a lot of information. I give literature that I've written myself. I hand it out. I'll give them references. And then we'll talk about different products they can get a hold of and purchase and so on. And so I do all these things. It's really an interesting arrangement that I have. It's my own, and everyone has their own. Anybody who does, I think, things that like myself, and I bring my own uniqueness. Everyone is unique, so my own approach might be different from someone else's, and I enjoy what I do. I love seeing people smile and leaving with that hope and that feeling that, thank you. I appreciate what you've done.
Oh, totally, totally. I mean, viewers, if you were to go with Dr. Maria to the public store, you'll find so many people recognize her and thank her for, the difference she's made in their lives. But what I got from, your answer, among many things, is the fact that healing, medicine, its practice, as you call it, or as the world calls it, is as much an art as it is a science. And it's as much that's, deep study of human psychology, all the different factors that go into making us who we are, the history, not just the family history, the personal history, the emotional background, all of these things, enter into your own unique approach, I would say, which I guess is, again, very rare these days, where all that usually people do is, okay, do this test, do that test. And, the art of diagnosis is disappearing. It's just, the tests are determining the course of action. And sometimes people are, completely missing the whole point and going in wrong directions simply because they are not looking at the whole person, and there isn't that deeper empathy. And then the patient themselves, have very little to do. They feel disempowered and trapped, in fact. In your approach, it's very participatory, starting with
Yes.
putting them at their ease. And it's beyond the usual politeness or the, proverbial good bedside manners, so to speak. It's much beyond that. It's a real involvement in the well-being of another fellow human being who also, I guess, shares this miraculous gift of life. But we will continue in this conversation, viewers, and please do like, share, and subscribe to our channel. And remember, this is not medical advice, and do consult your physician before you make any changes. But gradually, I guess, we need to think about most of these issues at a deeper personal level and start taking action ourselves. With those words, thank you once again, Dr. Maria. Thank you for helping us out today and hope to see you soon. Thank you and namaste.
Thank you so much.